Having discussed weight loss medications in the first part of this two-part video series on weight loss treatments, we will now turn our focus to surgical interventions. If you haven't seen part 1, you can find the link below. While maintaining a balanced diet and engaging in regular exercise are crucial for a healthy weight, sometimes these strategies may not lead to substantial weight loss. In such instances, weight loss surgery can serve as an effective alternative. Throughout this conversation, we will delve into the various weight loss surgical options, highlighting their advantages, risks, and outcomes. Additionally, we will discuss the criteria for choosing the most appropriate procedure and emphasize the significance of post-operative care in ensuring long-term success.
A gastric balloon is a non-surgical, temporary weight loss treatment. The procedure involves placing a soft, silicone balloon inside the stomach, which is then filled with saline or air to partially fill the stomach. This animation, for instance, is showing the Orbera gastric balloon being placed inside the patient's stomach after sedation, using an endoscope, which is a flexible tube with a light and camera. The endoscope is inserted through the mouth and down the esophagus into the stomach. The deflated balloon is then advanced into the stomach using the endoscope. Once the balloon is in the correct position, it is filled with saline or air. This partially fills the stomach, creating a feeling of fullness and reducing the amount of food the patient can eat comfortably. The gastric balloon is designed to be temporary and is typically removed after 6 months. The removal process is similar to the placement procedure. The patient is again sedated, and the endoscope is used to puncture and deflate the balloon. Once the balloon is punctured and fully deflated, it is carefully grasped using a specialized retrieval device or forceps. The deflated balloon is then gently pulled out of the stomach and up through the esophagus, finally being removed from the patient's mouth. Several variants of the gastric balloon are made by different manufacturers. One of them is the OBALON balloon system that uses capsules containing deflated balloons that the patient swallows. The balloons are then inflated once they reach the stomach. Unlike other gastric balloons that require an endoscope and sedation for placement, the OBALON balloon is contained within a small capsule attached to a thin catheter. The patient swallows the capsule with water, much like swallowing a pill, and without the need of sedation. Once the capsule reaches the stomach, an X-ray is performed to confirm its location. The balloon is then inflated with a safe, medical-grade gas through the attached catheter. The OBALON balloon system usually involves the placement of 3 balloons over 6 to 12 weeks. This staged approach allows for better patient tolerance and weight loss results. The balloons remain in the stomach for up to 6 months. The ReShape dual gastric balloon consists of 2 connected, saline-filled silicone balloons that are placed in the stomach. It is placed inside the patient's stomach using an endoscope. Once the balloons are in the correct position, they are filled with saline and a blue dye which helps detect leaks. The 2 balloons are connected by a flexible silicone shaft. The ReShape dual balloon remains in the stomach for up to 6 months. The SPATS adjustable gastric balloon is unique in that it allows for adjustments to the balloon's volume during the treatment period. This feature can help improve patient comfort and enhance weight loss results. It is placed inside the patient's stomach using an endoscope. Once the balloon is in the correct position, it is filled with saline. The SPATS adjustable balloon remains in the stomach for up to 12 months, which is longer than most other gastric balloons. The removal process is similar to the placement procedure. Once the balloon is fully deflated, it is carefully grasped using a specialized retrieval device or forceps, and gently pulled out of the stomach. Specific indications for gastric balloon placement can vary depending on the type of gastric balloon and the patient's individual needs. However, some general indications include a BMI of 30 or higher. Some specific balloon systems may have different BMI requirements, such as a range of 30 to 40. In some cases, a gastric balloon may be used as a temporary measure to help patients lose weight before undergoing bariatric surgery, reducing surgical risks and complications. Gastric balloons are a non-surgical alternative for individuals who do not qualify for, or are not interested in, undergoing more invasive bariatric surgery procedures. The expected weight loss after gastric balloon placement varies among individuals and depends on the type of balloon used, the patient's commitment to lifestyle changes, and adherence to the recommended diet and exercise plan. On average, patients can expect to lose around 30% to 47% of their excess body weight during the 6 months after balloon placement. While gastric balloons can be an effective weight loss solution for some individuals, there are potential drawbacks and risks to consider. Here are some of the cons associated with gastric balloon treatment. Gastric balloons are not a permanent weight loss solution. They are typically removed after 6 to 12 months, depending on the specific balloon system. Some patients may experience side effects after gastric balloon placement, including nausea, vomiting, abdominal pain, bloating, and acid reflux. Though rare, complications related to the gastric balloon can occur. These may include balloon deflation, migration, or rupture, which could require urgent medical attention or removal. While gastric balloons can result in significant weight loss, the amount of weight loss is generally less than that achieved with more invasive bariatric surgery procedures, such as gastric bypass or sleeve gastrectomy. Certain medical conditions, such as gastric ulcers, gastrointestinal obstruction, or a history of bariatric surgery, may disqualify a person from undergoing gastric balloon treatment. To maximize the effectiveness of the gastric balloon and maintain weight loss after its removal, patients need to commit to significant lifestyle changes, including a healthy diet, regular exercise, and potentially behavioral therapy. Adjustable gastric banding. This procedure involves placing a silicone band around the upper portion of the stomach to create a smaller pouch. The band can be adjusted by adding or removing saline solution through a port that is placed under the skin of the abdomen. The band restricts the amount of food that can be consumed, leading to a feeling of fullness after eating small amounts of food. This procedure is usually recommended for people with a body mass index of 40 or higher, or for those with a BMI between 35 and 40 who have obesity-related health problems such as high blood pressure or diabetes. It is considered a less invasive and reversible weight loss surgery compared to other procedures such as gastric bypass. The amount of weight loss that can be expected with adjustable gastric banding can vary from person to person and depends on a variety of factors such as starting weight, age, gender, and overall health. However, on average, patients can expect to lose about 40 to 60% of their excess weight within the first 2 years following the surgery. Here are some advantages of adjustable gastric banding. It is less invasive and it is reversible. The procedure is generally safe, and patients can usually return home the same day or after a short hospital stay. The band can be adjusted to control the rate of weight loss and to address issues such as excessive hunger or difficulty swallowing. Patients typically experience a significant reduction in appetite, leading to weight loss. Adjustable gastric banding can improve or resolve obesity-related health conditions such as type 2 diabetes, high blood pressure, and sleep apnea. It is important to mention some potential disadvantages to gastric banding. The procedure is not a quick fix and requires lifelong commitment to healthy eating and regular exercise to maintain weight loss. Weight loss may vary from person to person and may be slower than with other weight loss surgeries. There is a risk of complications such as band slippage or erosion, port problems, and the need for additional surgeries to correct these issues. Adjustable gastric banding may not be effective for everyone, and some patients may not lose as much weight as they hoped or may regain weight after some time. The procedure can be expensive, and insurance coverage may not be available in all cases. Sleeve gastrectomy is a type of weight loss surgery in which a large portion of the stomach is removed to reduce its capacity. The remaining stomach is reshaped into a narrow tube or sleeve-shaped structure. This procedure is typically done in a laparoscopic way, which involves making small incisions in the abdomen and using a camera and surgical tools to remove part of the stomach. The reduction in stomach size leads to a decrease in the amount of food that can be consumed at one time, resulting in a feeling of fullness with smaller amounts of food. Additionally, the part of the stomach that is removed produces hormones that stimulate hunger, so removing it can also decrease feelings of hunger. Sleeve gastrectomy is typically recommended for people with severe obesity who have a body mass index or BMI of 40 or higher, or a BMI of 35 or higher with obesity-related health conditions such as type 2 diabetes, high blood pressure, or sleep apnea.
The amount of weight loss that can be expected after a sleeve gastrectomy varies depending on several factors, including the individual's starting weight, age, sex, overall health, and adherence to post-surgery lifestyle changes. On average, people who undergo sleeve gastrectomy can expect to lose between 50% to 70% of their excess body weight within the first 2 years following surgery.
Like any medical procedure, sleeve gastrectomy has both potential benefits and risks. Let's start with some of the pros. Sleeve gastrectomy can result in significant and sustained weight loss, which can improve obesity-related health conditions and quality of life. Removal of the part of the stomach that produces hormones that stimulate hunger can lead to a decreased appetite and a feeling of fullness with smaller meals. Sleeve gastrectomy is less invasive than other types of weight loss surgeries, such as gastric bypass, and may have a lower risk of complications. In addition to weight loss, sleeve gastrectomy may lead to improvements in obesity-related health conditions, such as type 2 diabetes, high blood pressure, and sleep apnea. Let's move to some of the cons. As with any surgery, there are risks associated with sleeve gastrectomy, including bleeding, infection, and other complications. Sleeve gastrectomy permanently alters the size and shape of the stomach, which can affect digestion and nutrient absorption. In order to maintain weight loss and improve overall health, individuals must commit to making significant lifestyle changes, such as adopting a healthy diet and engaging in regular physical activity. After sleeve gastrectomy, some people may experience side effects such as nausea, vomiting, or acid reflux, which may require additional treatment or medication. Gastric bypass is a surgical procedure that is designed to help individuals with severe obesity lose weight. It involves creating a small stomach pouch by stapling a portion of the stomach together, and then connecting the pouch to the small intestine, bypassing a portion of the stomach and the upper part of the small intestine. The purpose of this procedure is to limit the amount of food that the individual can eat at any one time, and to reduce the absorption of calories from the food that is consumed. The smaller stomach pouch also produces less of the hunger hormone ghrelin, which can help reduce the individual's appetite and food cravings. The surgery is typically performed under general anesthesia and can take several hours to complete. The recovery period can vary, but most individuals are able to return to normal activities within a few weeks. The amount of weight loss that can be expected from gastric bypass surgery varies depending on a number of factors, including the individual's starting weight, overall health, and commitment to lifestyle changes following the surgery. However, studies have shown that individuals who undergo gastric bypass surgery can typically expect to lose between 60 to 80% of their excess body weight within the first year after surgery. Gastric bypass surgery is typically recommended for individuals who have a body mass index or BMI of 40 or higher, or a BMI of 35 to 39.9 with significant obesity-related health problems such as type 2 diabetes, high blood pressure, or sleep apnea. It may also be recommended for individuals who have tried other weight loss methods without success. Other indications for gastric bypass surgery may include obesity-related joint pain or mobility issues, increased risk of heart disease, stroke, or other obesity-related health conditions, difficulty performing daily activities due to obesity, inability to achieve significant weight loss through diet and exercise alone, desire to improve overall health and quality of life. Some advantages of gastric bypass surgery include significant and sustained weight loss, improvement or resolution of obesity-related health conditions such as type 2 diabetes, high blood pressure, and sleep apnea, increased mobility and ability to perform daily activities, improved overall quality of life, reduced risk of heart disease, stroke, and other obesity-related health conditions, potential for long-term weight loss maintenance with adherence to lifestyle changes, reduction in hunger and food cravings. Gastric bypass surgery, while effective for weight loss and health improvement, has several potential drawbacks that should be considered before making a decision. Some of the cons of gastric bypass surgery include: the surgery is a major procedure that carries risks and complications such as bleeding, infection, and blood clots, as well as potential long-term nutritional deficiencies. Significant lifestyle changes are necessary after the surgery, including dietary restrictions and a commitment to regular exercise, which may be challenging for some individuals to maintain. While weight loss is typically significant and sustained, there is a risk of weight regain if the individual does not adhere to the recommended lifestyle changes. The need for ongoing medical monitoring and follow-up appointments after the surgery is important, which may require additional time, effort, and expense. The surgery may have negative psychological effects such as body image issues or depression, particularly if the individual does not achieve the desired weight loss or experiences complications. Not everyone is a candidate for gastric bypass surgery, and insurance coverage for the procedure may vary depending on the provider and individual circumstances. There is a potential for the need for additional surgeries or medical interventions in the future, particularly if complications arise. AspireAssist is a weight loss device that involves a tube inserted into the stomach through a small incision. It works by removing a portion of the food from the stomach through a tube before it is absorbed. Following a meal, a bag filled with drinking water is attached to the device. The system is then connected to a small button on the skin, which connects to the tube leading to the stomach. When the lever is rotated, food in the stomach begins to empty into the toilet. When the flow stops, the clamp is closed and the bag containing water is squeezed. This infuses water into the stomach to help loosen food particles. Emptying starts again once the clamp is opened. The process can be repeated until the draining stops and about a third of the food is removed from the stomach. The rest of the meal is digested normally. AspireAssist is typically indicated for use in adults who are at least 22 years old and have a body mass index of 35 to 55. The device is intended for patients who have tried and failed to achieve and maintain weight loss through non-surgical methods, such as diet, exercise, and behavioral modification programs. Some contraindications include inflammatory bowel disease, uncontrolled hypertension, history of gastrointestinal surgery or gastric ulcers, or an increased risk of bleeding or infection among other contraindications. In a clinical trial that led to the approval of AspireAssist by the FDA, patients with the device lost an average of 31.2 pounds, which was 31.5% of their excess weight and 12.1% of their total body weight after 1 year.
As of April 2022, operations of Aspire Bariatrics, the company responsible for AspireAssist, were halted and the device was withdrawn from the market due to the financial consequences of the COVID-19 pandemic. It remains uncertain whether the device will make a comeback in the future.
In conclusion, weight loss surgeries and procedures can be life-changing tools in the battle against obesity. We hope this video has provided valuable insights to help you make informed decisions on your weight loss journey. If you found this information useful, please give the video a thumbs up, subscribe to our channel, and share it with others who might benefit. Thanks for watching.